Welcome to this episode of NLN Nursing Edge Unscripted, the scholarship track, where we celebrate the published work of select nurse educators from the NLN's official journal, Nursing Education Perspectives, and our NLN Nursing Edge blog. The conversations embrace the author's unique perspectives on teaching, learning, innovations, and the implications they have for nursing program development and enhancement. Today, I have with me as guests from a publication in March-April 2021 of our Nursing Education Perspectives, and it was entitled Microaggression in Academia, Consequences and Considerations. And my speakers today with me are Dr. Kumhee, Assistant Professor at Seattle University College of Nursing in Seattle, Washington, and Dr. Joshua Villarreal, who is a PharmD, a clinical pharmacist at the University of Washington Medical Center in Seattle, Washington. Welcome to you both. Thank you for being here.
Yeah, thank you so much for inviting us, Sue. It's an absolute pleasure to be part of this podcast.
Thank you for having us.
Yeah, absolutely. And we're really excited to have a little conversation about this unique manuscript. And, you know, as we read through much of the media in higher education, some of the racial issues that have surfaced over the last year have really come to the forefront in education, in academia in general. And when I was reading your manuscript, it discusses microaggression as a concept that, of course, is receiving popular attention, but as a concept, it really hasn't been addressed, really in the context of healthcare. Healthcare itself, healthcare education, or academia for that matter. And I just think it's really a timely and important conversation that's really happening across our country. And addressing it head on relative to health, education, and academia is the setting that you're addressing in this article. And you both come from very different professional areas. That was one other thing that piqued my interest as I was reading about the authors. And so I'm wondering if you would maybe talk to us a bit about your backgrounds and how you came together to explore this concept.
Yeah, thanks for that question. So Joshua and I actually first met about 10 years ago in the emergency department at the University of Washington Medical Center. And he was working as an ED pharmacist, and I was a nurse practitioner. I still practice there in the ER. Although we are in different disciplines, our programs of study are very similar. And it was about addressing health disparity in this country by increasing diversity of our workforce. So his clinical background and his Latinx community, and I, as a first-generation immigrant working with underserved population, we were keenly aware of this issue. As we all have heard, Institute of Medicine talks about inequalities in healthcare. And about 17 years ago, so in 2004, there was a Sullivan Commission report that was led by Bob Dole, and it discussed increasing diversity of our healthcare workforce as one solution to health disparity. It talked about how diverse healthcare workforce, so nurses, pharmacists, providers, are more likely to serve in our underserved communities to their own communities and can help work to reduce the health disparity. So my program of study or my scholarship is focused on interventions to promote health equity for vulnerable and underserved communities. One area that I've looked at is in academia, nursing academia, and students of color is our future workforce. But I wanted to look at the people who can better support students of color. So that was specifically looking at our faculty of color. And so one study I did, which was a national descriptive survey, and it is published now in the journal Professional Nursing, titled Perceptions of Support for Nursing Faculty of Color. And there were about, I think, 120 participants. From that study, I've asked them if they would participate in a qualitative study. So these participants, there were about 16 across the country who participate in a qualitative study titled Desire and Receive Support, Voices of Ethnic, Racial Nursing Faculty. Now that study is in manuscript preparation, but as I was interviewing them, the microaggression examples and that comment, implicit bias, came up a lot by these participants. So I knew that this wasn't something that was unique to nursing or in academia. And so, I reached out to my research collaborator, Joshua, and we talked about that. And we talked about writing a short discussion paper about microaggression. And so that's how this article came about.
Interesting. Joshua, are you going to say more to that, add more to that?
There's not a lot to add. That's a wonderful response. Really, I think what really speaks to me about Kumhee's response is we have both experienced firsthand the effects of health disparities. That's really at the root of everything that we wanted to address. And ultimately, if we think about why are we doing this work, we feel that one of the strongest ways to address health disparities is to increase the diversity of our workforce. That's at the basis of the descriptive study that Kumhee was telling you about and the current study that we're working on. And we can't really increase the diversity of the workforce without addressing the faculty and the faculty of color in our academic situations or our academic institutions. The paper that you're referring to, this manuscript, specifically looked at nursing academics. Mm-hmm. But of course, we find what Kumhee and I talk about all the time is that everything that we're seeing applies to virtually every healthcare setting academics. We certainly see it in the pharmacy world, the same concerns, the same issues with microaggressions and lack of diversity. So we're really kind of finding that our work together reinforces one another as we look at nursing, we look at pharmacy and the healthcare world in general.
Yeah, and so wonderful to mention that because it isn't just one discipline. As we think about this as a nation, it really is kind of infused everywhere. And how do we all come to terms with that as a community of educators, especially as we think about academia or community of practice, as we think about our healthcare settings. One of the terms, though, that as you think about this notion of microaggression, you define that in the article a bit as sort of subtle, powerful, often unintentional. And either side of the fence, some see it as an oversensitization, victim mentality, and others argue that overt racism alone doesn't explain some of this. And so, the debate is out there. And I really appreciated this context because as I was thinking about this, trying to explore the differences or how you link microaggression with, for instance, implicit bias, where does one end and the other begin, or are they one and the same? And I think sometimes semantics can often get in the way, and people can dismiss the notion just because, well, it's semantics. So I think it's really important to understand this, when we get down to the bottom of this. And I'm wondering, as you begin to explore your thinking, talk a little bit about this meaning of implicit bias and where does microaggression connect is on this continuum, because I think that's really important.
No, it's a wonderful question and a fascinating question. I want to address some of the things that you mentioned. A lot of really interesting things. When we wrote this manuscript, we did spend time addressing the criticisms of you're just being too sensitive, you're making too much out of this. And I feel like through the work that Kumhee and I have done, and Kumhee, you can probably speak more to this, the work that we've done with students, I'm not hearing any of that from students. What we're hearing from the students is a demand for change, which I find to be very hopeful and very rewarding. And even the voices that at one time said, I don't see what the big deal about this is, things have changed so dramatically and so rapidly that I feel like people as a society are more open to the question of how do we increase diversity? How do we increase the representation in the areas that we need it most? So I think that is all very hopeful. Now, the question of microaggressions and implicit bias is really an amazing question. I think in this paper, we present the idea that really microaggressions, particularly that aspect of microaggressions that is unintentional, the person committing the microaggressions will often say, I didn't mean anything by it. And implicit bias, which we describe as being a set of beliefs or prejudices just outside, just beyond consciousness. So there's what we know that we think, and then there's these kind of unknown, unseen forces that influence really everything that we hold. In that regard, microaggressions can be seen as a window into the implicit bias. It's the physical manifestation of those things that we suspect people believe, and that's what makes it so damaging. There's a fascinating study that was actually done before the microaggressions conversation out of Princeton in 2007. So we would call this microaggressions, but at the time they referred to it as prejudice behaviors. And the question was, how does observing a prejudice behavior affect cognition? Like, how do we measure the effect of these prejudice behaviors? So they took a group of undergraduate students and they exposed them to a variety of incidents that were based on prejudicial behaviors. And then they performed a series of cognitive tests immediately afterwards. And the first thing that they showed was that, yes, actually there was a noticeable decrease in cognition after simply observing what we would call a microaggression. So that's a reinforcement of kind of what we know, that these have real physiologic effects. The second thing that they found was that decrease in cognitive function was measurable in Black participants as well as white participants. And I think that's an important point, because one of the points that we always want to make is that anytime any member of society is affected by this, we're all affected by this. And this is a very literal manifestation of the fact that these hurt everybody. It's not just communities of color that are hurt by this. And so we all have to bear a responsibility in this. But the really interesting thing that gets to the link between microaggressions and implicit bias is that Caucasian participants received the biggest decrease in cognitive function as the prejudicial behavior became more explicit. So the more egregious, the more obvious the behavior, the worse the post-test cognitive function. African American test subjects had the greatest impact on cognition when the prejudicial behavior was ambiguous and uncertain. And there are a lot of reasons why this may be. And the only two groups studied in this test were African American subjects and Caucasian subjects. So we don't know how this correlates to Latinx communities or Asian American or Indigenous. But it certainly lends strength to this idea that the real impact of the microaggressions is, first, the processing of the negative emotion that occurs after you've experienced it or observed it. And then all the work that you have to do afterwards to say, did this really happen? Mm-hmm. Am I really seeing what I'm seeing? What does this mean about what people really think about me? That is the part that is as damaging as anything else, right, specifically for communities of color. So I think that's a really vivid description of how microaggressions and implicit bias lead one into the other.
Yeah, I think that people who have experienced this describe microaggression as like paper cuts. So one paper cut, it hurts a little, but thousands of paper cuts over your body. So they really hurt. And, as Joshua mentioned, implicit bias can influence our behavior despite this countervailing intentions. So we have fair-minded people to be unwittingly complicit in the perpetuation of inequality in the forms of this verbal and nonverbal. There's this kind of ongoing disrespect and intolerance towards minorities. And I think what I wanted to share with you is some of the microaggression examples. Like Joshua talked about this kind of ambiguous examples. And, you know, there's some, I think I remember this one particular participant who shared this. She wanted to be the chair of this committee. And so the members in that committee needed to vote. And there were probably a couple people running for that. She fortunately got the chair position, and the administrator in that committee said to her, "Oh, I thought you didn't want to work hard," was the comment that she's made. And she had to wonder, she thought it was kind of insinuating that, and she was African American, and still thinking that Blacks are lazy is kind of how she interpreted that, instead of maybe the administrator saying, "Congratulations, we look forward to your leadership." And there are other examples that they gave me, such as one participant was recruited or got hired in a very prestigious nursing school. And she went back to her school where she got her PhD to share how you can get your first job. And the facilitator was talking about how you have to use your every attributes to get this. And I think someone else made a comment about, hey, did you get that job because affirmative action? Things like that, that again, insinuating that she got the job not because of her qualification or her achievements. And I think they're very hard. If you're hearing indirectly or directly that you don't belong in academia, then they subconsciously start to believe that they don't belong in academia. So this isn't just about recruitment, you know, it's the retention issue as well. American Association of College and Nursing data. So this report is 2019 about our faculty of color in the United States. We have about 15% or so, 15.8% of faculty of color. Yet we have students of color, probably 33 to 35%. And we're going to see a demographic change in 2050. We're going to see our majority of our population is going to be the minority population, so Hispanics, Blacks, Asian. And I think it's really important that our workforce reflect the communities that they'll serve. Our faculty reflect the students that will be in academia. So we want that to align.
Yeah, thank you for that. You know, what was striking to me was the nature of implicit bias and how that impacted just as severely as more, you know, overt, but with different people. And so that was really a valuable piece in terms of the continuum and understanding how it does impact with that study. In the manuscript, you discussed some evidence-based strategies, and you named a couple of things like gender bias habit-breaking interventions and prejudice habit-breaking interventions. And I'm wondering if you can talk a bit about these strategies as ways in which we can work toward improving what we're currently seeing.
Yeah, I think that's an excellent question. Prejudice or gender bias habit-breaking interventions were mentioned in our article. So you heard, you know, many companies and institutions talk about mandatory diversity training, but you know, it lacks rigorous evaluation. So we're not really sure if they're effective or they're lasting. And you know, we have some cases where the threat of behaving with bias may even like lead some people to just avoid members of the minority groups, kind of in an effort to prevent the possibility of biased behavior and that negative feelings that may follow. So this particular study that we cited in our article is a paper that was by Dr. Forger and his team. It's published in 2017, and I can talk briefly about that, and for details you can read that article. So he replicated a study done by Drs. Patricia Devine and William Cox, and they were both at University of Wisconsin-Madison, and they wanted to treat unintentional bias as breaking a bad habit. So what he did is he replicated the study. There were about 300 or so, a little less, psychology students, and there was a control group and intervention group. It just one thing to point out. It said it was non-Black students, and but we don't really know if it included Hispanics or Asian and Native Americans. So there is that question. Anyways, the control group had an implicit association test, IAT, and I could talk a little bit about that. And then they got a feedback after they did that association test. Now, interestingly, with the intervention group, they had more sessions of different strategies. So they had the implicit association test and the feedback, but they also had an educational session, which talked about, kind of going over what is implicit bias. They had a training session, which included the effect it could have on implicit bias. They talked about 5 cognitive strategies. So there were more teaching going on. And then they also did an essay. So that's a kind of a brief how the intervention group and control group had a different things. And then they followed them every other day for 2 weeks, just to see if it would last. But that's only for 2 weeks. But they measured that every other day for 2 weeks. So you can kind of see the difference between the original study and this study, as there's a nice table in the article. And it was looking at their awareness, the concern for discrimination, and motivation to change. And in general, I think it had some promising results. But you can tell just from what I shared with you, this is more than just a typical mandatory diversity training. It was a little more intense, right? I looked at another study that I didn't mention in the article, and it was 2019. The same author, Dr. Forshire, did a meta-analysis of over 400 studies to see if there is a positive change and if it has that sustaining effect. And I think it showed that there is very slight change with all these interventions. And it was a questionable, I thought, about how long it lasted.
I think so. I love that study, Kumhee. I think it's about 70 pages, so it's,
Oh, wow.
you have to, it's a commitment, but it is, it's the Forshire Group. It's an amazing study. And I think what's really encouraging about that study is that it begins to break down the characteristics of the different approaches. And one of the really optimistic things that gives us hope is just since this manuscript, the Microaggressions manuscript, has been published, we've seen a tremendous amount of literature out there. There's qualitative studies and focus group studies looking at students in nursing, medicine, and pharmacy. There are studies that describe very specific tools and methods. There's a microaggression triangle model that's being proposed out of UC Davis, workshops to help people address this. But this meta-analysis that Kumhee's talking about, I think it's really fantastic that they are able to describe a handful of components that seem to be more effective than others, which is really kind of, like Kumhee says, the starting point to help us understand how you can begin to affect this behavior. And I also have to say, simply the fact that you can change implicit bias, that implicit bias can be viewed as a habit, is not an assumption I would have made a few years ago. I think my assumption going into this is that you're locked into implicit bias. The best you can do is acknowledge it and balance it out with diversity around you. But the idea that it might actually be changeable is a very exciting idea for me.
Yeah, I think it's important that we start to learn, or we learn to feel comfortable in having these uncomfortable conversations, because you learn so much just talking to them, right? I know you can make mistakes, but really come with that mindset of curiosity, knowing that you can make mistakes. Yep. That is how we're going to learn. So I think those are good points.
Well, it kind of rings true to some of the work that, in making a link that we've done just in studying theory-based debriefing methods, when you think about how we debrief people and some of those, the critical theorists. And it reminds me of Freire's book, Pedagogy of the Oppressed, when he wrote about dialogue as being one of the main factors in coming to understand perspective, and that ability to be totally curious. And if we can make ourselves curious, some of that implicitness goes away, because you tend to break that wall where people see you as authentically curious. And that changes the dynamics in the conversation. As you talk about some of these challenges, you know, when we talk about the many inequity challenges, things we've just discussed, I also hear the call for academia to step up and use some of these evidence-based strategies more. And some of them do, you know, are more than just come to this workshop. So, you know, professor checks off all of the colleagues in his department. Yep, they went, we're good. You know, that we have to do more than that. And so I'm wondering if you could elaborate a bit more, and perhaps both of your workplace environments have begun to do some of that work, even in the healthcare setting as well as academia, and talk a little bit about that.
Yeah, I love what you just said. It's not about checking off boxes, right? It is a lifelong commitment. So I would say, I would look at this more on 3 different levels. I would say the first is kind of at an individual level, 2 would be more on an administrative level, and 3 on a system level. So on an individual level, I don't think it's responsibility of one committee, such as DEI committee or Office of Diversity, Equity, Inclusion, but that everyone should feel this deep sense of urgency to step up in academia and make the much needed change. A lot of times people are not even aware of their own sense of privilege or the isms that exist in everything. I think it's really important that we learn to be more self-aware, that we reflect more, and there's this empathy. And as I've stated, to have this approach or mindset of curiosity to learn more about diversity and understand where they're all coming from. On an administrative level, I think leadership has a great influence, and they need to come with very intentional, it needs to be very strategic in their approach. This year, beginning of this year, I had an opportunity to present to the deans and the directors of nursing schools in Washington State. And I made recommendations how they can enhance the support for faculty of color based on my quality study that's still in manuscript preparation, and how they can build culture of trust. I think one thing that was brought up is also this, you know, ideally they wanted people who've had the lived experience. So that's talking about diversity in academic leadership also. But the 5 themes that was mentioned was about art of inquiring, listening deeply to the voices from our culture, lend action to words, harnessing the power of network, and striving for true genuineness while seeing inequities. And I know we don't have time to elaborate each one, but those were things that was mentioned by the faculty of color and how they would feel more supported by administration. On a system level, we need to understand that DEI efforts have blind spots, they have holes. And so we need to implement strategies that are precise, they're measurable, and that they have that lasting effect. It's not just that one time and you're good for that day, but that it'll have this lasting effect.
Yeah, and what was striking to me was the development of genuineness. So, you know, you hope intention brings that.
When we hear from faculty of color in these studies, over and over, the word genuine comes up because people recognize when something is authentic and when it's not. And one of the foundational observations of Kumhee and my work goes back to that 2004 Sullivan report, that for 17 years now, we've been hearing about the need for diversity in healthcare. And every professional organization has a statement supporting diversity, and almost every academic institution has a statement. And yet we're still in this dire situation where there's very, very little representation, at least compared to where our population is. And so we're looking for dramatic changes there to demonstrate genuineness. And like you say, people can tell when something's just a checkbox. We hear about from institutions across the country, there's a diversity and inclusion committee, but I don't know anybody on it. There's a mentorship program, but I've never had a mentor. Things like that. And I think what's really encouraging right now, I'm in a unique position where I'm part of a departmental pharmacy program, and I'm part of an academic pharmacy program. I help coordinate the two. And I'm seeing what I would describe as genuine change in both cases. There's a very active, rigorous diversity inclusion committee that reaches across both institutions. We're seeing changes in hiring practices, in programming practices, and courses. And I think the challenge for every academic center, there are going to be basically two challenges over the next few years. One is going to be to demonstrate true genuineness, because that is what we're hearing people demand. And the other is to stay ahead of the students, because the students are the moving force. You want these changes to be top down, and the students are providing so much energy and impetus and demand for change that it's really going to be hard for any administration to actually get ahead of that. It's an exciting challenge to have, but we have to do it, because when a change isn't top down, it becomes very difficult to manage, and the students are demanding nothing less.
Well, it's exciting to hear these changes, and exciting to hear that that you're making progress, or you feel as though that you're seeing some of that change come through.
We know that faculty of color demand diversity. We know that they're leaving as a result of kind of these slights, these microaggressions, because they tell us. And it seems like we're getting to the point where enough people are recognizing that we're trying to understand what we can do to overcome it.
I think it's something I do want to point out is sometimes we focus on the outcome, on the diversity only, which means, we're going to measure this by looking at the number of increased number of faculty of color, increased number of students of color. But really, you need to look at also the whole package, which is not just diversity, but the equity, inclusion, and belonging. So that they're not just there. You increase the number and say, okay, great, we have 40%. We're done. But to really feel like they're heard, they feel like they're respected, they feel included, they feel like they belong.
Yeah, more emphasis on the qualitative component of this and not just the quantitative number.
That's right.
Yeah, makes a difference. Well, I thank you both for taking the time to have this dialogue with us and to share your thoughts and a little bit more of the background that makes this particular manuscript really important. So thank you.
Yeah, thank you so much for the opportunity. I hope it was informative.
It's been a pleasure. Thank you so much for the time.
You're welcome. And for those of you who are interested in reading more about this, you can find Microaggression in Academia, Consequences and Considerations in our March-April 2021 issue of Nursing Education Perspectives. That would be volume 42, issue 2. So thank you.